Okay, so welcome everyone. Today we're very privileged to have Dr. Shin, someone who is a qualified medical doctor who's also very passionate about educating the masses on the importance of nutrition and lifestyle on our state of health. So today the topic is on inflammation and the impact of lifestyle as well as food choices on joint pain and joint inflammation. Okay, Dr. Shin.
So thank you very much as you invited me for this sharing. So first of all, today as we are going to talk about arthritis, so I'm going to give everyone a general view about what is actually arthritis and what are the what we call it, the main groups of arthritis that people are facing nowadays. So there are a few main topics that I'm going to share with everyone today. Basically, what are the types, which types of joint pain? Of course, we have to know the root causes, because without knowing the root causes, it is always impossible to reverse the disease. If you want to reverse something, we have to go and look for the root causes instead of just using symptomatic treatment to mask the symptoms. So of course, the impact of diet and our environment on joint inflammations. What are the 5R principles, which I'm going to talk about that later on. Of course, the food choices, which will impair the healing of the inflammatory joints, or which will reduce the joint inflammation, how to choose and what to choose. And lastly, a little bit about role of marine phytoplankton. All right, so a bit about myself. So before I venture in functional medicine, I'm actually an internal medicine practitioner. That means I see a lot of cases, I make a lot of diagnoses based on investigations, and I prescribe medications. So after some time, I found that patients are just getting more and more medications instead of, instead of reversing disease, they are just keep on adding more medications. Thus, that make me, start to change my direction from being just a conventional, traditional Western medicine doctor to a more of an integrative practitioner. All right, so well, before I start off, I would like to highlight to everyone that, of course, most of the time nowadays, a lot of people are complaining of a lot of musculoskeletal pain, where we have to know that actually all of this, is a structure from our spine, our ligament, tendon, muscles, all the soft tissue, which will have to hold our bone, our spine, and all these important spare parts, so that we have the flexibility, and we will reduce all the inflammation. So when we talk about musculoskeletal pain, a lot of times nowadays people are complaining about, neck pain, lower back pain. So I found that during my practice, a lot of times it is actually due to a very bad posture. So nowadays, too many gadgets, too many facing computer, and all of these, and lacking too sedentary lifestyle, lacking of appropriate or exercise that fit or suitable to someone, because I think exercise is something that should be personalized as well, and not to say everyone must do a cardio or must do yoga. So it should be personalized according to someone's needs. But very, very important is in between, we have to always know whether our posture is in a correct, whether we are in a very neutral posture, or we are always, hunching or in a very incorrect position. Either when we are sitting, when we are standing, or when we are doing our daily activities. That's why sometimes when patients come in, for example, they don't exercise for some time and they start to engage with, let's say, jogging, and they will start to complain of lower back pain. So why does this actually happen? So Linda, do you always have this kind of complaints from your patients?
Okay,
from your clients?
first of all, most of the women that we work with, they have lower body pain. That means knee and hip issues first. So posture is, of course, I agree with you, but most of the issues that we deal with are starting from the knees and the hips. Usually
I
the, yeah. And of course, we know that when the knees are compromised, then the other parts of the body starts to get compensated now, because the body always move in a way to avoid pain. And that's how imbalances and degeneration eventually happens.
Yeah, correct. So that's why pelvis itself is so important. I found that a lot of us actually having a very unstable pelvis. So that's when we have that unstable pelvis, we will start to utilize a wrong group of muscle. So like people who went for jogging every day, you may think that jogging is very good, but if you are engaging a wrong group of muscle, then probably you will start to have, for example, lower back pain, which is so common. That is why I think before we started to know the life, of course, what kind of diet and all this, we must first be very conscious about our posture. I think that is very, very important.
It's fantastic that you brought this up, because one of our elements, one of the components in our core program is DPM strengthening, damage-proof muscle strengthening. There are 5 groups of core muscles in everybody body that we must strengthen, so that the muscles can do the work instead of always slamming and compressing onto the joints.
Yeah, true. Agree with that. So, for example, very common nowadays, people will have neck pain, huh? And even in very young, like 20-ish or 30-ish group, patients group, they will start to have neck pain as well. Of course, usually these are due to cervical spondylosis, which is the degenerative changes. But ultimately, these degenerative changes will also become an inflammatory state. Okay, so that's why when we talk about neck pain, when it is prolonged, due to the incorrect posture or the curvature start to change, of course, due to the friction in between the bone, in between the spine, they will also cause a lot of bone spur, start to generate a lot of bone spur, and thus, when the bone spur start to grow more and more, it can actually compress on the nerve root and causing symptoms like pain, shooting pain, or even, like tingling sensations. So all this we have to pay attention. So when the inflammation starts, usually it starts with pain, usually lah. So because we know inflammation, 5 main signs: swelling, pain, redness, warm. So all this mean we have to catch it earlier, so that to prevent more and more degenerative changes. All right, so I would like to highlight on this, because a lot of people, they will wait until the pain become really unbearable, then only they approach the doctor. Either they will go to the pharmacy and they will get steroid or painkiller for themselves. And actually, this is not the right way, because you are just masking the symptoms without finding out what is actually causing the pain. And this is very dangerous, because sometimes it can be some very big or serious problems. For example, it can be an infection, where like TB, tuberculosis, or of course it can be malignancy, which we have to pay attention in different age group, or different if you have any hereditary genetic causes. So that's why I want everyone to pay attention to your symptoms and detect early, rather than just using medication at the beginning until very late stage. Then probably you will delay, you will cause more issues in later on. So here, healthy spine is always in between the body of the vertebra. There will be a intervertebral disc, and this disc is like a sponge. Okay, so it will absorb the pressure. So when we age, or when we take a lot of caffeinated drink, or when we sleep, we don't have a very restful sleep, or we don't drink enough water, all these very basic things actually can cause the disc to degenerate faster. Of course, as I said just now, posture is one of that, and also nutrition. So that's why without knowing the anatomy, maybe sometimes people will just think that you ask me to do this, I will do. But when you start to know about the structure, you know what is the function of the teeth, then you will always remind yourself, oh, I need to drink more water, to keep this sponge, can absorb more pressure and etc. So of course, as I said just now, if these degenerative changes continue, the bone spur is going to worsen the bone spur growth, and it will of course cause the narrowing of the intervertebral disc, and eventually maybe some people with heavy load or because of their occupation, they need to carry things where they carry in a very poor or wrong posture, that can of course increase the risk of slip disc. And of course, metabolic issues means obesity or overweight can always cause slip disc to happen as well. All right. So, sorry. Okay. So next, so just now I talked about degenerative joint disease. I'll just skip this. Inflammatory joint disease is another big group. For example, rheumatoid arthritis, which is becoming more and more common nowadays, is a type of autoimmune diseases. So autoimmune diseases, that means our own body antibody start to attack our own body structure. It can happen anywhere, actually, in any organs or any system. So very common, I mean, ladies that can get rheumatoid arthritis at their age of 30-ish or 40-ish. A lot of people at the early age, they may not realize until they start to find that their joint become really stiff in the morning. Usually it's a morning stiffness, and it prolonged for more than 3 months, 6 months. Then they start to realize something is not right. So of course, rheumatoid arthritis, it can happen with other autoimmune symptoms as well. For example, some people always complain of dry mouth, dry eyes, okay? All these dry syndromes can also combine with rheumatoid arthritis. Not only that, depression, mental issues, all this also is a type of autoimmune disease that can sometimes happen together with rheumatoid arthritis. So beware of any of your body sign, any signals that the body give you, you have to start to be very alert, because autoimmune tend to attack human. And of course, certain type of that, like SLE and all those, they attack younger age. So like, teenagers, 20-ish. So that's why nowadays, when people start to facing infertility issue, then only they found out that, oh, actually I'm having autoimmune diseases. So that's why paying attention to symptoms, very, very important. I want to highlight on this. So of course, with technology nowadays and more education, so very seldom we will let the patient to progress to this stage of, joint deformities. Usually we detect them quite earlier, unless the patient, they really ignore the symptoms, and then these joint deformities will start to happen. So rheumatoid arthritis is an inflammation, it's a chronic inflammation. And sometimes when patients have the flare-up, the acute inflammatory response, so their joint will really be swollen up, okay? They will have a lot of pain, redness, and etc. So a lot of times they will just try to take painkiller. All right. And once they start to take painkiller, they feel a bit better because the inflammation reduced. But again, because this is an autoimmune issues, so the condition may happen again and again. And what trigger all this again is our environment, our diet, which playing the main role. Of course, hormonal as well, and other factors, which I will talk about it later on. Okay. So very common, as you said just now, Linda, which is the lower back pain. So most of the time, lower back pain can be due to, like sleep disc, can be due to just muscle spasm, can be due to maybe you play golf, you don't know how to play, and you just sprain your muscle. Okay, so all these are very common, but in elderly, we do not forget about fracture as well. Sometimes when the bone is too fragile, it can also cause compression fracture, and it can lead to, of course, more neurological symptoms, like numbness, even, you know, you can't really move, all these. So neurological symptoms. We don't wait until that. Again, before that, usually are pain, tingling, numbness, and etc. Okay, so joint pain. Most of the time nowadays, people are having mechanical pain at the beginning. But once mechanical pain progress, it may become inflammatory pain as well. Okay, it may be transit to become inflammation. So mechanical pain, of course, so for example, what to do? Because sometimes when we suddenly have some joint pain, okay, a sudden one, it may be a flare-up of a chronic inflammatory condition. For example, gouty arthritis. Gouty arthritis, in fact, is actually an inflammatory condition. But when they are silent, when they don't have any acute inflammation happening, you may not feel much pain. But the joint itself actually already have a lot of all these crystal deposits. So with our immune system drop down, or when we are in a high stress condition, all these can cause the inflammation response to suddenly flare up. So of course, very important to ask yourself, is there any recent trauma? Okay, usually an acute one, idiopathic, or did you strain or repetitive straining? Any ligament, tendon, muscle involvement, all of this usually related to mechanical pain, and it usually improves with rest. Okay, pain changes and worsen with movement. Okay, localized or radiation pain, but usually localized, and respond to conservative treatment. That means if you use some anti-inflammatory drug, or you rest, you use some, if acute pain, usually we have to use cold compress. But if the pain, like just now I said, if it's a chronic one, if there are a lot of inflammatory cytokine inside the joint, then we have to reduce, we have to increase the circulation. So we have to use warm compress to increase the circulation, so that all these inflammatory deposits can, you know, clear out from the joint space. Because we have to know why most of the inflammation started from the joint. Because joint itself, the circulation is very slow. So it's like a, you know, like a waterfall, okay, to the downstream. Everything, the bad one, the deposits, all comes down to the downstream, and the deposit over there is like our joint. So this joint area with very, very low circulation is a very potential site for inflammation to happen. So once you started to have any joint pain, that means probably your other areas soon or later will start to have inflammation as well. All right. So and then about inflammatory pain. So inflammatory pain, most of the time the onset are more gradual, okay, compared to mechanical pain, which is more acute. So not only that, usually the pain, as I said, worse in the morning. So sometimes people, the ladies can just complain of, I have difficulties to open my fist in the morning, okay? And it usually lasts for some time, you know, maybe more than 30 minutes, more than an hour. After that, if you don't move, if you move it, you will feel better. So it improves with movement, which is the other way with the mechanical pain, and it worsens if you just rest it. Okay, so if this condition, if you are facing this kind of pain for more than 3 months, then you really have to look for a doctor to just make sure, are you having any rheumatological issue, which is, means you have to see a rheumatologist maybe. Then maybe we have to rule out autoimmune causes. Because in conventional medicine, autoimmune is something which is unable to reverse. But in integrative holistic medicine, everything is possible, because we do believe that our body have the own healing, you know, power. So as long as we provide the correct environment, we provide the correct nutrition, they will automatically know what to do, how to heal. Okay, so but then for me, the early detection is to make sure, okay, so the diagnosis itself may not be so important, but if we already know it's an autoimmune causes, then we have to find out the root causes. Okay, so and because as I said, if we just ignore them, it can spread to a systemic involvement. All right, so what are the red flags? As you see just now, a lot of people, they are actually having chronic back pain, and during my practice these few years, as in for the past decades, I've seen patients
So knee pain. Just now I say knee pain. Knee pain lead to back pain, but usually it's knee. By the time they come, it's usually the knee that's in problem.
I see. Okay, so of course, actually chronic back pain also is a very, very common, symptoms that patients have. And during my practice these years, I've seen a few, actually, quite a lot of patients, male patients, which continuously having back pain. And what they do is usually they will go and see a doctor, and doctor will prescribe them painkiller, non-steroid anti-inflammatory drugs. Okay, so after 1 time, 2 times, 3 times, the pain is still there and is progressively not improving. So when this kind of situation happen, we always have to think about malignancy could be one of the cause, because very, very common prostate cancer can metastasize to the spine and cause very bad chronic back pain. So so we do not want to delay the diagnosis until very late stage. So for all the gentlemen, especially after 50 years old, do pay attention on this, because prostate issues get worsened after age of 50, and by every decades it increased about 50%. All right, so of course, when you are very young and you start to have back pain, also you have to be very careful. Have to think about whether it is something autoimmune related, like ankylosing spondylitis, which I recently have another young chap, 26 years old as well. Keep on doing a lot of physiotherapy, taking medication, but the back pain is just not improving. So in the end, I have diagnosed him with ankylosing spondylitis, which is a type of autoimmune disease which attack the spine, which will cause stiffness of the spine. That means he can't really bend. As time goes, the spine will just fuse. And usually it starts with the pelvis area, or the sacroiliac bone. Okay, so progressive symptoms that can involve neurological deficit as well. Any bladder or bowel dysfunction, of course, that is very bad already, because it has spread to other organs. Past history of cancer, because that can indicate a metastasis. Weight loss, okay, always a very important constitutional symptoms that we have to take note. Of course, if you are using any drug, okay, night pain, systemically unwell, you always have fever, on and off, night sweat, it could be TB, okay. Chronic oral steroid use, because chronic oral steroid use will, for example, people with asthma, people with any joint pain. I have a lot of elderly patients which like to, buy themselves the steroid, the prednisolone, okay, from the pharmacy. And after some time, because prolonged steroid usage will actually cause even worsen the osteoporosis. And chronic oral steroid usage, oral or even spray, anything, as long as a steroid, actually they will also suppress our immune system. It will cause, because our body will think that there is external steroid coming in, so I myself no need to produce my own steroid. Where corticosteroid, all these cortisol are very, very important to play a role as an anti-inflammatory hormones. Okay, so here I want to highlight, do not simply get medication from pharmacy, or I do not know about Singapore. I think it's quite tight, right, about steroid usage. I mean, do you guys can get the steroid over the counter, or you need a doctor prescription?
Sorry, can you ask that again?
Yeah, about the steroid, like prednisolone. Do you need a prescription, or you actually can get it over the counter?
Frankly, I never do any steroids before in my life, but based on the limited knowledge that I have, some medication are possible after the initial prescription. You can actually get it. You get it yourself.
That's why. So have to educate the clients about steroid, because long-term steroid usage can cause diabetic, can cause high blood pressure, can cause weight gain and a lot of other issues, especially will suppress the immune system. Okay, so of course, in immunosuppression patients, we have to be extra careful, like HIV patients or patients who are receive chemotherapy and etc. History of trauma, as I said just now, or when we do examination, are there any refer pain? So what happened when patient is not responding? Then we have to start to think about it's time to really refer, because I found that a lot of wellness center in Malaysia. So when patient have pain, they will start to do maybe do a lot of more holistic treatment lah. Like sometimes they will do massage, they will do all this to try to reduce the muscle spasm. But when that doesn't really work, so it's time to really refer out the patient. So we have to rule out infection, osteomyelitis, TB, spine, all the autoimmune condition, malignancy, and etc. All right. So why does arthritis actually get worse? And why is it like the age, the patient's group which got arthritis is getting younger and younger? So all of this, of course, could be because we actually we forgot about finding out the root causes. As I said just now, everything actually, most important is actually started from the guts. So if no matter how good the diet is, how balanced the nutrition is, but if you don't have a very good stomach or your digestive system is not on a good condition, for example, you're always facing like burping, bloatedness, okay, indigestion, constipation, you may be having problems with your intestine as well. That's why you may have a lot of nutrient malabsorption, even though you are eating a very good food. Okay, so pay attention on that. So inflamed guts, because a lot of patients, a lot of times when patients have all these issues like burping, bloatedness, they will start to take probiotics. But probiotics itself actually is important because it will balance up our good and bad bacteria. But very important is inflammation of the guts. So when the gut started to inflame, by purely just using probiotics, it don't really work. What you have to do is you have to eliminate food that will provoke inflammation. You rest the guts so that the guts have time to heal. Then at this time, you give the guts the good things, the proper nutrition for them to do the healing work. Okay, poor diet, as I said just now, of course, poor lifestyle, high oxidative stress. Okay, a lot of time nowadays, we thought that stress is just from financial, work stress, study stress, family stress. Actually, not only that, allergies itself is a type of stress. Okay, food intolerance, for example, today you have taken some gluten, and after gluten you always will have burping or bloatedness. This could be a type of food intolerance where the body is telling you, no, I cannot accept this. So in long term, it actually causes stress to your body. But without knowing that, we continue to trigger this stress response. Okay, so this is a very how to say something that we ignore. We thought our body can handle, but in long term is actually provoke chronic stress, and chronic stress will stop the healing or delay the healing of everything in our system. And not only that, because of low antioxidant, high stress but low antioxidants. So here I want to highlight a lot of times we thought that everything we can get it from the diet, but some of the vitamins, for example, C itself, C is very important for joint and also for liver. Not only that, C is a very main component to fight stress. However, C we cannot produce ourselves. So that means we either have to take from the food, or if you have certain disease, like for example, you have a fatty liver or you have a very bad joint pain, gouty arthritis, actually C is, you actually have to extra, provide your body with supplementary with some C at the beginning, at least, because you know that if you are just purely taking from a normal diet, you may not be able to, get the improvement. You want to fasten the improvement, So you need to fill up the empty jar so that the body can start to use all this fuel to run. Okay, so the low antioxidants, sometimes you can see it from where, for example, your serum uric acid. Okay, uric acid is actually a very a lot of times we just look into high uric acid. We are very worried about high uric acid that can cause gouty arthritis. But in fact, too low the uric acid, it is actually an indicator of low antioxidant. That means your body have start to use up your own antioxidant, which is the uric acid. Okay, so do pay attention on that if you are doing some blood tests. So of course, environmental toxins like medication, all the food additive, artificial food coloring, GMO products, plastic, our skincare, and etc. Hidden allergens, okay, like of course, gluten, all these dairies are very potential allergens. So people who have joint pain, okay, later I will talk about that. And of course, infections, we have to clear it. If you consistently having joint issues, you have to also be aware of, is there any hidden infections? So of course, another common group of joint problems can be start off by metabolic issues. That means either some of the hormones imbalance, for example, they are insulin resistant. For example, chronic stress, too low cortisol. As I said, when cortisol is too low, there will our body cannot actually fight the inflammation. Hyper or hypothyroidism, also something that we have to pay attention. Where nowadays a lot of people are in a suboptimal hypothyroid state. That means they always feel cold, they have constipation, they have hair loss issue, their skin appear to be very dry, they have irregular menses. All these may be indicator of a suboptimal hypothyroid. That means it's not an obvious low thyroid, but you start to experience this, and that means your body metabolism has slowed down. And as I said just now, if you want all the inflammatory deposits to clear off from our body, the metabolism must be good. That's why a lot of people with metabolic issues, for example, overweight, obesity, diabetic, high blood pressure, all these metabolic issues, most of the time, at some point of time, they will definitely experience some kind of joint pain. Either it can be gouty arthritis, it can be osteoarthritis. It will be in a faster state. It will happen earlier than other age group. Okay. Of course, estrogen dominance. Okay, estrogen dominance can cause weight gain. Okay, so estrogen, as we know, is a female hormone, very important for us to become very youthful. But at the same time, if we have too much, it can cause a lot of breast issue, like even breast cancer, lump, fibroid, and etc. And at the same time, it actually can increase the joint disease, the risk of getting joint diseases. Okay, so inflammation, as we know, they are actually acute and chronic inflammation. Acute inflammation is very important because it allows our body immune system to do its job, to start to clear off everything that is bad from our body. However, if this inflammation doesn't get to clear out at the definite period and it get progress, how come it will, getting worse and worse, the inflammation from acute become chronic? So it's because the environment is whatever we feed ourselves, is whatever we do every day. Do we have a good rest? Do we actually sleep well? Do we exercise appropriately? For example, if you already started to have knee pain, do you still want to go for Zumba? Do you think you still want to go for, Tabata or anything that is too fast, or you have to land on your knee? So all this will worsen the inflammation. By right, actually at the acute inflammation period, the most important thing is to rest. Because while resting, and of course using some other integrative methods, then the inflammation can start to slow down. Then only we go to the second step. Okay, so that's why during acute inflammation, like physiotherapy and all that should be withheld for a while. Then only later on, once the inflammation started to reduce, subside, then we start to introduce all these physical therapy. But of course, maybe in different individual, they will have different approach. I guess Linda will know this quite well. All right. So of course, chronic inflammation will lead to eventually a very dysregulated immune system, because eventually our body just become, they're just confused. They do not know of what happened right now. How come everywhere looks like, on fire? It's like a war. So they do not know what to do. So they start to attack here and there. Thus, a lot of time, chronic inflammation can progress and turn into an autoimmune condition, or autoimmune diseases, I mean. All right. So nowadays, we are seeing actually all these joint disease become diagnosed in a younger and younger age group.
If you want to find out more, then come and join me at my upcoming webinar called Slim, Sassy, Strong. It is totally free, and I invite you to come and learn how to regain your mobility, how to eliminate joint pain, and even regain your youthfulness within 90 days. This webinar will be a safe space for all of us to learn more about transformative healing and resilience. To get registered, simply click on the link around this video, go to the next page and secure your seat to the webinar. I look forward to seeing you there.
And why? Of course, sedentary lifestyle, not moving much, very stressful lifestyle. Sleep, we don't sleep well, we sleep very late, or we always have an interrupted sleep, or we have too many dreams. Dreams are actually good, but if too much and we don't feel energetic in the morning, then something is not right. Of course, smoking, all right, and pollution, all right. All these environmental factors can of course increase the risk of joint diseases. Second, of course, are all about our diet. How can people 2 decades ago, 3 decades ago, they live so healthy, they can live until age of 90, 100, but nowadays, people at age of 30, even 20, they start to complain of pain, they have infertility issues, they have mental health disorder, they have all sorts of complaints. Why? It's thanks to our, very advanced technology, okay? Because of all this technology, because of the environment, because of all this processed food, so our diet has changed. And because of that, it contributes to all kinds of diseases. So here I want to highlight, actually all diseases begins in the gut. This is very, very true. Without a good gut, everything will just, become worse. So about the 5R approach is about remove. So what kind of food or what kind of things to remove or eliminate are very important. We must first identify that, elimination. And second will be restore, and then we have to repair, reinoculate back, and then we have to know how and when to relax. So when we talk about remove, as I said just now, allergens are one of the very important factors. I found that a lot of patients with joint issues, actually there are intolerance to, like, for example, gluten. Gluten are usually food made by barley and wheat, okay? So please pay attention when you go to the supermarket, when you want to choose something. If you always have joint pain, maybe at the beginning, 3 to 4 months, try to get gluten-free food, gluten-free diet, because wheat can somehow cause more inflammation in our guts, okay? So it's a type of allergens. Not only wheat, actually, soy as well, okay? A lot of time nowadays, soy and corn are GMO products because we need it in a high volume, okay? The demand is too high. So to increase the production, usually they will use all these genetic modifying method to fasten, to get all these products done. Including
non-GMO soy.
Yeah, so non-GMO soy is you can, of course, is what I mean soy here for ladies, especially perimenopause or menopause ladies, soy is a very important factor because it will provide us with phytoestrogen. Phytoestrogens means a type of plant-based estrogen. However, if we are taking it in a processed form means like, for example, a lot of ladies would like to take soy shake. Okay, so if currently you are really having some gut issues, you can't really digest very well, yes, maybe at the beginning you want to increase your muscle mass, you can temporarily take for a short period of all these shakes. But in long run, actually is not so good. I still prefer patients to go through natural whole food soy. That means today, if you buy the soy, you soak it overnight, and then you blend yourself, fine, it's fine. Okay, like fermented soy are very good as well, like natto, like tempeh, those are very good. So here I want to stress on processed soy or natural soy. Okay, so natural soy is good. Processed soy can even suppress our thyroid function. So if you have suboptimal thyroid, hypothyroid issue, for example, your free T3, if you today you look at your free T3 level in your blood test, if you found that your free T3 is always less than 4, or your TSH is always more than 2, this means it could be some suboptimal hypothyroid condition going on. So in conventional doctors, we will all label them as normal. But for me, it is suboptimal. That means your metabolism will start to slow down. And once you started more processed soy, it will even suppress your thyroid more. So the TSH will even become lower and lower. Then you will have more and more symptoms, like as I mentioned, irregular menses, you will gain more weight, your cholesterol will start to increase. A lot of times we thought that cholesterol is all about food. Yes, 15 to 20% cholesterol increment is contributed by the food. But actually, most of that in ladies are actually due to the thyroid, a suboptimal thyroid. Okay, so do pay attention on that. So GMO products, allergens, soy, gluten, dairies. Okay, nowadays the farm-raised cow, they produce milk every day, but women supposed to produce milk only after delivery. So why does this, how come this will happen? It's because of some, of course, maybe it's not, of course, if not maybe, definitely it's due to some growth hormone injection. And of course, all these huge animals on and off, they will get sick. And when they get sick, they will be injected with, antibiotic, and they will be given painkiller. When we want to, slaughter the animal, we need to give them even, general GA to, make them sleep. And then only, all these medications, when they go into the animals, and after that we consume, so indirectly it will also spoil and damage our guts. Again, not only our guts, all the inflammation, all the hormones, the external hormones will also go into our body. That's why for me, I always suggest patients to go more on plant-based diet rather than animal-based. But of course, some of the nutrients, they are higher in animal-based food. So we have to be balanced, and we have to depends on individual, and we suggest an appropriate diet. Okay, depends on one needs. So infection, we have to remove infection if we found out that, for example, if some ladies they always have a lot of vagina discharges. Okay, so all these could indicate that there is some silent viral infection that happen in your vagina area or even in your cervical area. And bear in mind, our bladder, our womb, our uterus, and our guts in the abdominal cavity all are actually very nearby. The structure are all actually just surrounding each other. So all these bacteria, they can transmit here and there. So if you don't clear the infection can go into your guts as well and cause further issues. As I said just now, all disease begins in the guts. So of course, chemicals. For ladies who, especially ladies with estrogen dominance. Estrogen dominance, how do I know that someone with that kind of issues is, they always have PMS, premenstrual symptoms, weight issues, they have a lot of irregular menses, they have fibroid, they have breast lump. All these could be due to estrogen dominance, and we have to be very aware of BPA plastics, and because all these will also become an inflammatory deposits into our joint. Toxins as well, in all the artificial coloring, all the junk food. All right. So the first priority, as I said just now, is we have to triage to reduce the chronic inflammation. So how are we going to stop the vicious cycle? Is by right at the beginning, we should start to minimize and ideally eliminate entirely the NSAIDs, the painkiller or the steroids, because all this is going to cause more inflammation in the guts. Okay, so as I said just now, non-steroidal anti-inflammatory drugs that negatively impact our gut health. Okay, that can cause a lot of autoimmune issues, ulcer, heartburn, bacterial imbalance, and etc. Leaky guts. Okay, so all these food, are there really food? Or friend or enemy or foreign invader? So I guess everyone nowadays, even though we eat, some people they eat very healthy diet, but in the end of the diet or during the diet, they will add in tomato sauce, they will add in ketchup, they will add in Thousand Island on their salad. So actually all these still considered processed food, and they actually contain a lot of glutens and a lot of creamers and etc. So if you want your joint to be healthy, the main thing is start from your diet. Okay, and very simple rule, as I always tell my patient, if you can do it, half a plate comes from plant-based, should be vegetables and fruits, and better to be very colorful. Okay, to have different types of vegetables, for example, cruciferous vegetables, which is very good to help us to strengthen the liver, because cruciferous vegetables, they can help in liver detoxification. Not only cruciferous veggie means all the broccoli, all the cauliflower. On top of that, add in also leafy veggie. Leafy veggie are very high in minerals, for example, magnesium, calcium. All right, so actually we do not necessarily need to take milk to get the calcium. If you're only taking milk, as I said just now, all the dairy products nowadays are full with growth hormone, are full with a lot of injectable hormones. So you have to know your body. If you are around age of 40-ish, 50-ish, a lot of this group of ladies, they will definitely have some type of food intolerance, and usually one of them will be the dairies. So if you take that away, you will feel much better. Your guts will feel more comfortable. You will lesser all the bloatedness and burping will start to reduce. Okay, and of course, leafy, cruciferous, one more will be root vegetables. All the root-based vegetables are high in fibers. Okay, all the tuberous one, like sweet potatoes, like beetroot, like carrots, all these, it can keep us feel full. So we will not keep on snacking on those junk food, on those kueh or whatever. So all those will increase our refined carbo, and that will cause what we call that, weight gain, and also more inflammation will kick in. Okay, of course, we cannot lack of protein, because protein is very important factor in building our collagen, our muscles and etc. So 25% of it should be protein. So a very simple rule is every time you eat the plant-based, the vegetable-based should be more than the protein, especially if you are taking animal protein. So of course, you can try to increase more on the vegan-based, the plant-based protein as well. Plant-based protein, there are a lot actually. All the legumes are plant-based protein. Edamame, your chickpeas, your hummus, which made from the chickpeas, and what else? Your broccoli, your cauliflower, spinach. All those are actually high in protein, even though they are vegetables. Okay, so but then make sure because not everyone are suitable to take whole vegan diet. Okay, so it is again very individual. All right, and of course 25% can be whole grain or fiber rich, or so-called complex carbohydrates. But of course, if you are facing a weight issue which causing your knee pain, I always suggest my patient, maybe the dinner, you can remove the grains, you can remove your rice or your noodle. Okay, make it very simple, 70 to 80% fullness, so that your digestion go well and you can sleep very well, and that can help actually in terms of weight loss as well. And don't forget about antioxidants, because as we get age, oxidative stress will increase, and thus we need more antioxidant compared to when we are in a younger age. Of course, if you have a lot of stress in your body, you actually probably need a higher intake of antioxidants. All right. So this is the restoration partner. And of course, when we talk about arthritis, a lot of times it is about the bacterial imbalance, so-called dysbiosis in the guts. Why do we have dysbiosis? Of course, antibiotic usage. Like I said just now, when we take in a lot of animal-based product, all those will probably be having a lot of antibiotic in them itself. So all this can cause dysbiosis. Stress itself can cause dysbiosis. And on top of that, leaky gut. Leaky gut is another condition when usually if you look into this diagram, so symbiosis means everything work, you know, in a very harmonious state. But when dysbiosis happen, it will increase the dysfunction of the epithelial barrier, and thus it will increase more inflammation to happen. Inflammatory cytokine response will start to happen. And when that start to happen, you can see from here, the mucus layer will start to damage. It will start to damage our mucus layer. Thus, our underlying beneath, the cell beneath, the epithelial cell beneath will start to get inflamed as well. And when they get inflamed, they cannot work properly and they start to have gap. You see, initially, they will have tight junction. So nothing from the lumen can go into your blood. So here, this part is actually the blood vessels. So when the gap started to open, the cell, the epithelial, the intestinal cells started to have space. All these pathogens, all the gluten, all the dairies, they will go into your bloodstream and they will start to, you know, trigger off a lot of inflammatory response. And soon or later, they will also start to cause a lot of immune issues. Sorry. Okay. What happened? Okay, sorry. How am I going to clear that? Okay, so of course, when we talk about that, the next stage will be repair. So a lot of times we try to, you know, clear our diet, we try to exercise more, but after some time, the condition happen again, because the true healing or the repair actually doesn't really happen, or they happen partially. So two main reasons why are these things not achieved at times is because continuously we are putting in all the toxic molecules or the trigger food. That's why I say at the beginning, elimination for a good period of time. Depends on your condition. Maybe a good 6 weeks. Some people 6 weeks will do. Some people even up to 3 months. Then only slowly reintroduce back the food, because all these trigger food can interfere with the healing process. Okay, and of course, if we are lacking of certain specific nutrients that need to repair all the damaged cell, then it will also slow down the whole process. Okay. And as I said just now, a lot of times nowadays we have a very imbalanced bacteria in our body. Okay, because of whatever we eat, our environment, whatever we inhale or we put on our skin, all this can cause dysbiosis. And when this dysbiosis happen, when the bad pathogens getting more and more, the inflammation will get worse, and thus it will also affect our joint. All right. So here, if you always because nowadays I found that a lot of people, when they have some flu or they have some viral infection, but they will insist to take antibiotic. Actually, that's not right, you know. So viral infection, usually they will heal spontaneously. Like when you caught a cold, you know, you do not need any antibiotic. What you need is very good rest. You need hydration. You know, you need to let your immune system to work themselves rather than suppress them. By taking antibiotic, that is to fight bacteria. It's not to fight the virus. Okay, so bear in mind, every time when you really want to take antibiotic, please think twice. And also, if you can, you ask the doctor. But I'm not sure about, again, the doctors and the patients interaction over there, because sometimes a lot of doctors, they will tend to easily give patient antibiotic. Maybe it's a very conservative thinking that by taking antibiotic, your cold, your flu, everything will heal faster. Actually, that is not. It's your own immune system. All right. Well, next. So this is re-inoculate. So we have to slowly inoculate back the good bacteria into our body. How? By taking some of these fermented probiotics, like Greek yogurt, but of course you find those sugar-free Greek yogurt, because some Greek yogurt come with very high sugar content, and also non-GMO. Okay, if possible, all the grass-fed cow rather than the farm-raised cow. Okay, but maybe quite difficult to find sometimes. Of course, like tempeh, as I said just now, kimchi. Okay, all these are very good source of probiotics. All right. So
you have sauerkraut, German sauerkraut.
Yes, correct. So actually every country, like Japan, they have miso. So every country actually have certain type of fermented, very good source of probiotics. So we should, because I found that a lot of times we don't really take all these high probiotic food, like kombucha, but I also have to be very careful with kombucha, because nowadays a lot of kombucha are very high in sugar content as well. By right, the sugar fermented by the bacteria is a good sugar, but sometimes to make it more, tastier, people, the producer may start to add in some added sugar. So be aware. So learn how to read the labels are very important for, all of us. All right. So as I said just now, of course, a lot of times when we get age, we have a lot of periodontal issues, and all this, everything actually, as I said, guts, mouth is also part of the guts. So if we don't have a good oral health, that can also increase the risk of joint disease. So joint doesn't just come from the joint itself; it even can start from your mouth. So get a very regular dental check. And of course, if you on and off have all this gum bleeding, you have to look into it. Are you having any periodontitis and things like that? Because all these bacteria in long run, they are going to, stimulate all the immune responses as well. And of course, inflammation at the same time. All right. And lastly, very, very important, relaxation, where I think most of the people don't get enough relaxation nowadays. Until at night, we still need to work, we still need to reply all the message, face into the computer, looking into the account and etc. So this is a very bad habit. If we can, I always suggest my patient after sunset, no strenuous exercise, because our body need to rest. Because when sunset kick in, actually all the, cortisol, all the sympathetic hormones will start to reduce already. Then we prepare to sleep, we prepare to rest. However, if at this time you still ask your body to work, then you are going to provoke stress for the body, and in long run it can become a chronic stress and it can suppress your adrenal gland. So improve parasympathetic nervous system. Parasympathetic nervous system is a relaxation system where only when it is good, we can have a good rest, our digestion will be good, and when digestion is good, you can absorb whatever you are taking very well. Then you feel relaxed and you have growth, or whatever is damaged can start to repair. The immune system, the growth, the development, all start from the parasympathetic. So only one system can be dominant at one time. So if you're always in a sympathetic mood, if you're always rushing, in a high stress condition, your body cannot heal. Whatever good food you give to your body also cannot absorb. So this is a very, very important thing that I want everyone to, you know, try to apply in your daily lifestyle, as in give yourself some time to really, you know, have some conscious breathing, do some very gentle stretching, yoga, or even, you know, play with your pets. It can be just simply some music and singing. Singing is very, very good, because if you guys are doing yoga, you will know, right? When we sing, actually, you know, it's actually about the inhalation and the exhalation. So that's why during yoga practice, right, we always have some singing before and after that. All right. So all these are so important. All right. And slow down. I know Singaporeans, you know, always very rushing. So slow down is very important as well. All right. So here, minimize. What to minimize? Of course, all the pro-inflammatory food. As I said, high sugar definitely is one of the no-no. All right. High sugar, sometimes it can be a hidden sugar. Sometimes we will say, I actually didn't add any sugar in my coffee. I drink very plain, but I do eat matcha cake. So what do you think about the cake? So it's still high in sugar, you know, and it's because of the flour. The flour are gluten. And as I said just now, gluten is always one of the allergens that you have to keep away at the beginning. Okay. High fructose corn syrup. I want everyone to pay attention on that as well. Okay, a lot of fruit juice outside, or ketchup, or all these Thousand Island, actually they are high in high fructose corn syrup, HFCS. So if you flip to the label part, you will be able to see this. And be extra careful. So if you are not taking a lot of processed food, then you will definitely be able to avoid this. Okay.
There are also many disguises for sugar nowadays. So all the OSE, the toast, maltose.
Yes, correct.
Follows a lot of the disguise, because they come up with clever names to hide it. So
yes, you're right.
Right?
Yes,
that is a different form of sugar, but it's still sugar.
Yes, correct. Sucrose, maltose, fructose, and etc. OSE, correct. Okay. So we have to be a very smart consumer. Of course, nowadays, a lot of people that don't cook themselves. So what do you think people use, to cook outside, you know, the food, which tastes so good, but actually are full high in refined vegetables. Anything refined, even coconut oil can have refined coconut oil. Okay, even olive oil can have refined olive oil. So when we choose our oil, also we have to be very careful. So of course, oil that can resist high heat will be better, because it will be very stable, and it will reduce all the chemical changes that soon or later can cause DNA impact, or, you know, change our gene. Okay, so we have to be, if we can, we try to cook ourselves using good unrefined oil. If that means if you can, try to avoid vegetables oils. Actually, all the sunflower oil, canola oils, they are considered refined. So try to use more of, like, you know, coconut oil. Try to use all these avocado oil, olive oil. That will be better. And especially coconut oil. Coconut oil has a very high antibacterial, antifungal function. So if you do have, as I said, everything starts from the guts, right? So if you can, every day you can take a small amount of coconut oil, especially if they are in a medium chain triglyceride form. If you are having weight issue, you try to take it in the MCT form, medium chain triglyceride form. It can actually help you to, you know, get some weight down as well. Okay, so refined vegetables oil, what are the problems is they are actually very high in omega-6. And too much of omega-6 is always a pro-inflammatory, will contribute to inflammation. Okay, and high heat will increase the trans fat level as well. Okay, so that will be the refined vegetable oils. And of course, all the flour-based, all your spaghetti, all those are considered refined carbohydrates. Because in terms of carbohydrates, there are two types. There are simple, also called refined, and they are complex carbo. What we need are actually complex rather than a simple, because in terms of complex, they are formed by a lot of chains, and to break down all these chains, our body need time to break down. Thus, it will keep us feel full for a longer period. Then we will not keep on, feeling hungry, and we want to keep on keep taking snacks. Okay, so of course, processed meat, red meat, all those are, high in saturated fat, high in trans fat. And of course, many times they are having a lot of enhanced additives and, MSG and etc. Okay, so be aware of this, especially all the processed meat. Nightshade vegetables, okay? A lot of people who have joint disease, I found that they're also very sensitive to nightshade vegetables. But of course, maybe not all the nightshade vegetables. The common ones like, chilies, pepper, tomatoes. So one have to be they have to observe their symptoms. For example, I have patients who after 2 to 3 times of taking brinjals consecutively, then after a few days, she will start to have joint pain. And once she stopped that, the joint pain disappeared. Another patient of mine, at the beginning, a very young lady, 20-ish. At the beginning, she always have, all the muscle pain just like everywhere. Then one day she falls sick. So she didn't eat anything for the few days when she was sick. She just drink water and take very simple food. And amazingly, the pain just gone. The pain which followed for quite a few months are just gone. So here we can see that food is really something, if we are taking a wrong food, it can trigger all the inflammations. All right. And as I said just now, known allergens. So if you are someone who have asthma, some allergic issues like eczema and etc. or autoimmune issues, allergens can be anything. Of course, if you have very bad allergies, you can do some IgG or IgA antibody test that can roughly highlight to you what kind of food you have to pay attention. Okay, some your body are really sensitive to. For example, the common one will be gluten, dairies, wheat, soy. Some patients even eggs are also very common. So if you do have a lot of allergies issue now, maybe you can proceed with that for a short. You did the test and then you identify which food can really cause a lot of allergies response. Then you remove those and you will definitely see some improvement. But because IgG and IgA antibody tests, they are quite expensive. They are very expensive actually. And with times, these antibodies, they change. So maybe for a short period of time, you can use that as a guide. All right, if you have very bad allergies issues. Okay, so next, we have to maximize anti-inflammatory food, and of course to maximize antioxidant food, which are very important. Omega-3 fatty acid, as I said just now, omega-6 are more of a pro-inflammatory. Omega-3 are anti-inflammatory. Okay, of course, cold water fish, grounded flaxseed. Flaxseed itself, actually not much of omega-3. Only in a powder form, actually it comes with a high omega-3 content. All right, walnuts, all the algae, all right, like marine plankton, all of these are seaweed, nori, sea carp, spirulina. Actually, they are high in omega-3. But be aware of spirulina as well. Spirulina is actually a type of also considered algae that is actually very high in copper as well. Copper. Soy-based food also very high in copper. And a lot of time people who go into vegetarian diet, or we tend to eat more plant-based food, our copper actually will be higher. And copper and zinc, these two nutrients, they always compete with each other. So if the copper level in the body is high, the zinc will actually be suppressed. So, and we know that they have to be in a balanced state. Then only the immune system can be good. So maybe, actually, in my practice, I found that a lot of people, they are lacking of zinc. Because high zinc food, nowadays, the highest will be oyster. but how frequent we will eat oyster, right? So not only that, a lot of vegetables as well, they are high in zinc. Some like sunflower seed, all this, the seeds also high in zinc. Just that if you are consistently taking spirulina for some period of time, maybe you have to start to slow down and put in some zinc to balance up, to sort of balance up your zinc and copper balance. All right. Anti-inflammatory food. All right. Turmeric, as everyone knows, so good for the joint. But of course, if you really have very bad joint pain, the turmeric concentration, the dosage, should be at a higher one at the beginning. Of course, also depends whether your body can take it or not. Because everything when we consume, they definitely have to go through the liver. So if your liver health is suboptimal, then probably what kind of symptoms you will experience? The most common one will be, I feel heaty. I feel heaty. So if in that case, then maybe you have to slow down. Go slow. And then start to taper up slowly. Okay, cruciferous vegetables, as I mentioned just now, papain in the papaya, bromelain. So we even use all these extract to put in the joint supplements, bromelain, very, very good. And not only good for joint pain, actually very good for our digestion as well. Papaya, pineapples, that's why we usually use them to make as an enzyme. Okay, boswellia extract as well. Boswellia is a type of herbs that are very, very good, have very potential anti-inflammatory properties. All right, boswellia. Of course, when we come to antioxidant, all the citrus fruit. So when we talk about fruits, right, I want everyone to be very careful. The higher glycemic index of a fruit, which means the fruit is very sweet, then you have to be very careful. Because the higher glycemic index means the sweeter the fruit, actually the fructose content is high. No doubt they are good as in they have fibers, but then too high fructose, especially when you consume them at night, okay, too much, and your liver can't take it, because all the fructose must go through your liver to get metabolized. So if they don't, these fructose will turn into fats and stay in your liver. And in long run, it will become fatty liver. Okay, so fruit-wise, citrus fruit means very good. Go ahead. No matter how much you take, actually it's very good. Just be careful of your gum, because too much of citrus fruit sometimes can, have erosive, will cause erosive gum. Of course, berries are one of them. Olive leaf and olive oil. A lot of times we just think about the olive oil from the fruit itself, but olive leaf extract in fact have higher antioxidant, about 400 times higher antioxidants effect. And when we use on our patients, we can see, consistently for 2 to 3 months, we can see a huge improvement with olive leaf extract. Okay, of course, colorful vegetables, as I mentioned just now. Okay, next, bone broth is another one. Very collagen dense, high protein. And of course, if you use a lot of, carrot, tomatoes, and, potatoes to make the bone broth, it will also have multivitamins inside, all the provitamins A and etc. So try to take bone broth if you can. You boil already, you just keep in the freezer. Keep in the freezer, and you can, every time you need, you just heat it up and you drink. It's definitely very good for your cartilage, regenerations, and etc. And also good for your skin. All right. Of course, herbs and spices. All right, turmeric, ginger, rosemary, oregano. That's why people use them to make as or essential oil. So sometimes when you really have joint pain, you can even apply all this essential oil on your joint. All right. Next. Okay, so just now I have talked about minimize, maximize. Of course, we have to prioritize. Always keep yourself into these three main categories, then you will not go wrong. Prioritize your sleep. Okay, if again you have a very good diet, you have a good exercise, but you can't sleep well, you also can't, the joint also couldn't heal. And if you sleep, you should sleep at a good timing, like TCM that mentioned that the liver, are most active around 10 p.m. to 2 a.m. So of course, we want the liver to do the detoxification work properly. So we should sleep actually at that time frame, at least maybe not 10, but 11, before 12. So try to adjust your sleeping hours. Detoxification. So of course, you can make some detoxification juice. Like for example, you can use lemon juice plus cayenne pepper, cayenne pepper, and plus you can add in raw manuka honey. And on top of that, maybe you can also put in apple cider vinegar. This is a very simple detox juice, which is very good for weight loss and to reduce inflammation. All right. Intermittent fasting as well, I found it very, very helpful, especially in terms of weight control. All right, you can do just a 16-hour fast, but when you open fast, you have to be very particular. When you open fast, you don't just eat simple carbo food, okay? You start off with high protein or high good fat food. Then only maybe you want to take some carbo, is fine. All right, the way you consume the food in sequence are important. Weight-bearing exercises. I guess this one Linda will know the best. And of course, don't forget to breathe. Without a good breathing, the oxygen level will tend to be low. Without a good oxygen level, again, the tissue cannot be repaired. All right, so do not forget to breathe, okay? And breathe efficiently and consciously. Of course, in the end, marine phytoplankton, actually, I myself, I don't use much, but I have heard about it. Actually, all the sea algae, all the sea creatures, they are very, very high in minerals and nutrients. Just that one issue of that, of course, as I said, they can help in detoxification, antioxidants effect, and even protect ourselves from all the chemical and toxins. Just that one of the things we have to be careful is because like traditional Chinese herbal medications, sometimes all these are without true regulations. So we do not really know how pure is it. So that is the issue. If you can really identify a good one, then I think it's very, very good for people with joint disease.
So thank you, Dr. Wan Shin. It's really lovely to have you. So we really learned about the 5 R's today and about maximizing and prioritizing. So
Yes.
and I think you are if you're a man, you will be my soulmate, but what we do here. So the first phase of our program is, as we all know, is Eat to Thrive, where we actually really reduce processed foods, and then we increase the consumption of the raw unprocessed plant-based foods as healthy as we can, and we aim for low glycemic index, low GI, and as little genetic modification, as little hormones as possible. In fact, like the bone broth that you were talking about, we would encourage our clients to use range-free.
Yes, correct, free range.
So so that means the animals must be healthy. Our philosophy is that if you want to eat an animal, you want to think about whether the animal is healthy or not. If the animal is healthy, then when you eat the animal, you will not have problems. But if you eat an animal that's got sickness and diseases,
correct,
problems. That's one. And of course, plant-based is good. As we study all the blue zones in the world, the people who live the longest, happiest are the ones who eat plant-based, unprocessed food, right? But also, we found that people need some of the nutrients are found only in meat. And sometimes the fastest way to restore is also through the consumption of moderate meats. So then what kind of meats to eat and how to eat? And that is, again, you have mentioned, right? So we all know majority of it should come from plants, and then 25% or so from healthy meats. So that's in unprocessed.
High quality animal products.
Yeah, not like sausages or ham or like meat, right? But like fresh and
free range, preferably farm raised.
Happy and healthy animals, right?
But the problem is nowadays it's quite difficult to to sort of get all these actually.
So there has to be a bit of effort. So for example, ourselves, when we live this lifestyle, I literally go to many places to get my producers. We can't get it place. We have to keep shopping and ordering online, and it's difficult to find, but it takes a little bit of effort. We can still find Nowadays they've got this organic bone broth powder that we can order online. I think iHerb has it as well. I think our organic health store in Singapore, there's this Scoop Australian brand. I'm not sure whether they have it in KL, but in Singapore we have that, and you can buy packet form of freeze-dried, range-free bone powder. So then, like equivalent to you boiling for many hours, right? So then you just put a tablespoon of that, and it's literally the bone essence of range-free cows or lambs so we can use that as well. And I myself, I'm allergic to MSG. So MSG is the other thing that we talk about. Also, we encourage our clients to eliminate, the sodium as well. So you mentioned olive oil, and that is wonderful. We actually encourage using olive oil instead of the olives, because the olives are usually very over-processed. A lot of people think, oh, I eat a salad and I put olives on it and oh, it's healthy, right? But there's too much salt, and that kind of salt that's used is not a good salt. It's actually the table salt that's got too much sodium and potassium, and it messes up our body's ability to balance our own potassium content in the cell. So that's how high blood pressure, I'm sure you know about this as well.
So the sodium and potassium balancing.
Yeah. And then because we're not eating enough greens, potassium, so our cell is void of potassium. So that's how high blood pressure and hypertension develop, because the body is trying to squeeze the hydration into the cell. And that's how a lot of doctors will encourage patients to reduce table salt. But unfortunately, in our world today, you walk up, it's everywhere, right? It's so difficult to find. It's not easy to find a place that doesn't have MSG or doesn't have table salt. You actually have to request for it. I have a few little places that I go to that I'll tell them I'm allergic to MSG. So they think that don't have MSG, or if I eat nyang tofu, that's the only thing that I eat in Singapore now, that we get a lot of vegetables. And then I just ask for kosong, which is no noodle, and then dry, right? And then I will pour water over it to wash and rinse the vegetables. Then I eat it, then I'm fine. But otherwise, I get very bad MSG reactions. And everyone around me will say, how come we don't get it? And only you do, right? And a small handful of my clients, after they follow the lifestyle, they do. So I don't know, what is your experience with MSG? Are you also, are you also allergic to MSG? Does it give you any sign?
Yeah, actually, it is quite common. I do have patients have this kind of so simply saying, it's a type of food intolerance. Okay, like people are intolerant to eggs or dairies. There can also be intolerance to MSG. So again, we still have to look into is the gut inflammation. So once the inflammation if calm down, actually they can start to, we don't encourage people to take MSG, of course. But somehow we need to go out and, sometimes enjoy food with our friends. So thus, when the gut start to heal, then they will found that previously when I taken this portion of food, I will start to have reaction. But nowadays, I can actually tolerate. I don't have any symptoms. Yes, correct.
Clients who have overcome decades of rheumatoid arthritis and they lose weight and they heal from pain, previously they cannot taste MSG, but after they heal, and then they lose the weight already and they are pain-free, they are free of medication, they reverse their autoimmune. Now they can taste MSG and they don't like it. So then does it mean that their gut hasn't healed, or that really MSG is a neurotoxin and that we're not supposed to take that because it actually sends it messes up our
correct. Yes, it's a type of actually neurotoxin. So just that, as I said, is actually everyone have different tolerability to the food or whatever chemicals that we have. And also that have to depends on how good your liver actually process all these things. Like for example, some people when they go through a perfume department, right, they will start to have giddiness, they will start to complain of giddiness, headache. So that means this group of patients, definitely their liver is not good because everything that we inhale actually straight away goes into the liver. So liver is one of the very important part that we have to look into. And nowadays, so many people, especially people with overweight or obesity, they are having fatty liver. That means the normal cells has been replaced by the fatty cells. Thus, the functions of the liver has been reduced. That's why, liver is so important for detox, for metabolism, for making up new hormones, new neurotransmitters, antibodies, and etc. Yeah.
Amazing. I think we can wrap up today. So I'm just gonna thank you and wrap up first. Then we'll stop the recording and then we'll just have a proper goodbye lah. Okay. So thank you.
If you want to find out more, come join me at my free webinar. I will show you simple activities that you can do right away to resolve joint pain. And not only that, you will learn how to regain your strength and mobility too. I would really love for you to join. So simply click on the link around this video, get yourself registered, and I will see you really soon.
Slim, sexy,